let's record some normal values on our vital signs trend and trigger record. I'm just going to write them all up here so we can refer to these values as we document along. Let's say the blood pressure was 118 over 78. Temperature is 36.7. Pulse is 83. Respiratory rate 16. Oxygen saturation 98% on room air. Remember, RA stands for room air. Okay. Now, if you look at this portion over here, it says most and date. We don't really need to bother with this too much at the moment. That just stands for medical orders for scope of treatment, which is basically what is your patient's code status. And if their code status has changed, when did it change, and or the date that it changed. So you'll write that on here. And then just down below over here, this is also where we would write what our goals are for our patient. And again, we won't bother with that for today, but just a quick example would be if our patient had COPD, for example, our goal of treatment is not to maintain their oxygen saturation at a level that's not attainable for someone who has had COPD. So let's just say the maximum that they normally would have in terms of oxygen saturation is 88%, then we would write 88% down below. Okay, so I'm just going to use a blue ink so that we can see what we're doing over here, but typically you would want to use black ink. Occupy one column and you write the date. Let's just say today is the 10th of October, 2020. And the time, let's just say 0900 hours. And we didn't take our patient's weight, so we'll just draw a line right across. And we said the patient's temperature was 36.7. Over here, we can just go ahead and write 36.7. It's supposed to be a dot. For the blood pressure, remember that you want to try to use the legends that you have been provided as much as possible. So 118 over 78 is our blood pressure. So if this is 110 and this is 120, then 118 would be down here. So mark the point and then draw basically the tails or the V. Diastolic is 78. And again, 78 would be approximately over here. So again, draw the point and then draw the tails. The pulse is 83. That would be drawn with a dot, so it would just be right around here. Respiratory rate is 16, so that's right on the line. You can make this a little bit bigger if you want. And then oxygen saturation is 98%. And again, on here it says if it was between 92 to 96, then you would write the oxygen saturation on this line. Otherwise, you'd write it above 98%. And since they are not connected to supplementary oxygen, then we would just write RA for room air. And again, we are provided with some legends down to the right-hand corner over here. It says yes, check mark, no X, and NA for not applicable. Now it's asking you if your patient's vital signs, if they were within the expected range, then check mark. Oxygen requirements not increasing. Neurological status stable, if they were alert or easily roused. CAM score negative, we haven't actually discussed the CAM score. For now, we can just write a check mark. If their pain was less than or equal to the goal, or if it's not applicable, let's just say it's not applicable, they don't have pain, then we can put NA. If their urine output was adequate, if you have actually checked their labs, and if their results were normal or it's showing improvement, if the patient's overall status is stable, and if their care is escalated, then check mark, and then your initials followed by your designation. I may have a hard time writing my designation here, so I'm just going to write my initial, and then we'll write the designation down here. Okay, and that's how you would document a normal, normal trend, normal value. Okay, now let's say, for example, that our patient's values have changed. I'm just going to use a red pen here just so we can see and differentiate. However, you would still continue to typically use black even though your patient's values are abnormal. Let's say we're on a different day, 11th of October 2020. Let's keep the same time at 0900. Still no weight. Temperature now is 38.4. So you would write that above where you normally would write the value. So in the shaded or the grayed area. That basically highlights the fact that it's an abnormal value. For the blood pressure, I'm just picking an outrageous number over here. So let's just say the blood pressure was 180 over 102. Well, 180, we can no longer indicate that on the normal grid line. So let's write it up here, 180. And the diastolic is 102. And that's how you would write that. For the pulse, let's say the pulse is 102, so it's above the normal value. However, it still can be indicated on the grid line, so we can still continue to write it over here. Now, what some nurses will do just to indicate that it is above what's normal is they will write down the actual value, and they'll say 102. Respiratory rate is 24. Again, it's above the grid line, so let's just write 24 up here. Oxygen saturation is now 90%, and the patient is now connected to oxygen at 2 liters. So for that one, we would write it down below here, 90%. And they are now connected to 2 liters per minute. And again, LPM stands for liters per minute of oxygen. And let's write down 2 liters per minute. Now, vital signs are no longer within the expected range, so therefore we would write X, and then you would go ahead and fill in the rest. Oxygen requirements are not increasing. That would be a no because it is increasing. Maybe they're still stable when it comes to their neurological status. Maybe they're still alert and easily arousable, so on and so forth. So you get the gist. That's basically what we're doing.